One of the biggest causes of medical errors is due to miscommunication. Here to tell us about Pulsara, a real-time communication platform, is Lieutenant Forrest Winslow. Welcome to the show.
Thank you. Thank you.
Now, what is Pulsara?
So Pulsara is a smartphone application that is used by care providers either in the pre-hospital world out in the community to communicate patient care information on a HIPAA-compliant platform to the emergency department and even on into what we call interventional teams in the hospitals, be it a cardiologist when someone's having a heart attack or their team that needs to respond into care for them, or someone suffering from a stroke or trauma or any other time-sensitive emergency where we can get real-time information from the patient's bedside or from their home directly into even the home of a cardiologist who may be sleeping at 2 a.m. and being woken up by an alert saying you need to come in and do care for this patient, because most of the hospitals in the country don't have 24/7 coverage of specialties. So in those off hours, we need to be able to bring people in expeditiously.
Now, how does it improve care for patients?
So it basically adds a layer of transparency. So when our providers are in the field, they're capturing information, be it an EKG, a driver's license, so we can go ahead and get the person registered before they even arrive at the hospital, so they can quickly make it either to the CT scanner or the cath lab or trauma bay without any significant delay through that care. And at the same time, if the emergency room physician evaluates the information we put out there and they agree with it, then they can also, with a tap of a button, push forward, and then that information is then in the hands or in the mobile device of what that cath team or neurologist that may be doing the intervention.
Now, why is it important to reduce these times, and can you talk a little bit about prior to Pulsara, how things worked in regard to time?
Okay, so I'll speak to the time first. So in the case of, let's say, a heart attack, so someone that's having the most severe form of a heart attack, which we call a STEMI, which just means they have significant EKG changes. When we discover that by doing a 12 lead, what we know is if their treatment time from the time we touch them to them having that blood vessel reopened to get blood supply going back to the heart, if it exceeds 80 minutes, the mortality or the death rate exponentially increases at that point. And so we really have a goal in the state of Virginia where we want people to get treatment in less than 75 minutes. We have a mantra that we're saying drive to 75. The national standard is 90 minutes right now. That's what American Heart and a lot of American Academy of Cardiologists profess. But Virginia, we've tried to have a little loftier goal of 75 minutes, because if we know we can drive it below that 80 number, we can save a lot more lives by having timely care. And as far as, and the same in the stroke, the longer someone goes without blood supply to a certain area of the brain, we lose 1.9 billion neurons for every minute that the person doesn't have blood supply going to the brain. So that may be the difference of, a few minutes may be the difference of you knowing how to say your grandchildren's name or recognizing your spouse or physically being able to do something in a stroke. So if we can do rapid care, we can probably improve a lot of quality of life, and we can also decrease the death rate as well.
So phone calls and all of that takes time to
It does.
coordinate
Right.
care.
Exactly. So in the traditional system, our radio, we would send an EKG to the hospital for a heart attack. We would radio report them. Then they would have to turn around and call a hospital operator who would page multiple layers of teams. So through pages and phone calls, where now when we enter the information into the device, that can quickly be evaluated by the emergency room physician and then pushed forward to the entire team so they can see that.
Now, why do we need to use Pulsara in general medical complaints?
So in, excuse me, in general medical complaints, that's one of the platforms that we use, and a lot of times it just expeditiously, or it increases the rate and efficiency of what we can do as far as providing care. One of the things that we're hoping that it will do is it'll decrease the amount of time that our ambulances are spending at the hospital, because they'll already have a lot of the information that we traditionally were giving verbally. We're still going to verbally hand off that patient, but some of that demographic information can already be there in a platform to where our turnaround times are much better, and we end up getting care providers back out to the citizens in Chesapeake or in the Tidewater region to where we have better care with less providers.
So the care providers, the ones who are first on the scene, they're going to be inputting all of this information as they get it.
Correct, yeah. So, and I can show you a case.
Okay, absolutely. And
So,
I have one over here
exactly. So we'll, just so as a reference point, this one that I'm using here is going to be the EMS provider, and the one that I'm holding is the emergency department. And the one you're holding can be a care team, either a neurologist or a cardiologist coming into the whole system. We're able to hit alert. It takes us maybe 30 to 45 seconds to get all that information in there. And then the emergency department would receive the alert. And what you'll notice is that they have essentially the same information and view of it. And the physician could come in here and simply look at the EKG, pan in, and say, I want to look at those leads a little closer, which you can't do with a piece of paper, right? So old eyes like mine, it might be helpful. And then at this point, they believe as well that we believe this patient's having a heart attack. So they would end up going down here, and they would simply activate the cath team. And then this is physician, cath team, and the emergency department, or at home in bed, they would be awoken by this sound. And then they also would have the same information in front of them to be able to communicate back and forth between the teams and start responding in. This is all happening at the same time. We're packaging and getting ready to start moving to the hospital. So while we're moving the patient towards the hospital, the cath team is moving towards the hospital, because really the most important stuff happens in the cath lab, not in the emergency department. So we really narrow that window of treatment time by doing that.
And time is critical.
Time is critical, yep. You know, one of the things may be the EMS provider may say, I've given the patient aspirin. And so that's a very important measure for things. They might ask us to repeat the EKGs, and all that information flows back and forth, and everybody on the team is aware of it. One of the other great advantages is once the case is ended, the individual at the hospital will actually take a picture of pre and post care where they reestablish blood flow, and our care providers in the field, the EMS providers, get to see what happened to their patient versus kind of wondering whatever happened to them.
And this is fascinating. We definitely could spend more time on it. So if somebody wanted to learn more, they could go to the website.
They could go to pulsara.com and look at the website as far as content there.
And if you see a first responder on this, they are probably inputting information.
Correct, yes.
So don't assume they're on their phone or
playing on Facebook or
Absolutely.
Snapchatting. We have a couple of apps that we use on a regular basis. One of them is for medication safety called HandTevi, and then the other one that we use on the scene for this is also our Pulsara, and then we use our electronic documentation system as housed here as well.
Great information. Technology is wonderful.
All right.
Thank you, appreciate it. We have to take a quick break, but up next, learn how you can help clean up and beautify your community. Stay with us.